So next to go would be myself and Dr. Partha. And Dr. Partha needs no introduction. Is the Chairman Scientific Committee of AIOS, heading the BBI Foundation Group of Hospitals, and of course, the founder of Trinetralaya. And I would be talking on post laser vision correction, definitely with a multifocal. And unfortunately, he always decides to counter me. And against the motion would be talked by Dr. Partha Vishwas. So I think I would share my screen. Yes?
You want me to introduce you? The most dynamic chairman of the ARC we ever seen in the history of All India Ophthalmological Society. And that is only one and the only Chitra RAMAMURTHY.
So second that, Mohan sir.
Yes.
Thank you. Absolute second that.
Yeah. So here we go. So now I know I'm used to challenging Partha Vishwas, and it's unfortunate that he thinks by following me up, he can counter my questions. But here you are, post laser vision correction with multifocal. How could it not be a yes? Right now. So then this is how it goes. The illiterate of 21st century is not going to be those who cannot read or write, but actually those who can't learn, who can't unlearn what they have learned and relearn, were famous words. And believing what this very famous personality of the world had told us, the best way to create value in the 21st century is to actually connect creativity with technology, which means looking at the premium IOL segment. Now, this was a patient who came to me 2 decades back wanting a cataracts, wanting a laser vision correction, and she comes back wanting a cataract surgery. Now, she was so convinced about getting her vision off glasses, and how would she be ready to go for a cataract surgery and not be promised a premium multifocal? So what if she had undergone a laser vision correction? Her cataract was not too significant, but she was very, very clear that she wanted a multifocality. Of course, I need to be wary because these are a demanding set of patients, but doesn't mean that I buckle up for that. So I am going to look at the ocular surface. I am going to look at the diffraction, the topography, and I'm going to look right up to the retina. And believe me, I would look at the ocular surface, ensure that there is no dry eye. I would treat the dry eye. Her expectations are high. My expectations are high too, to get what she wants. And I would be sure that I get my accurate K value. I would be sure that I do a thorough job of a retina, ensure that I look up all those possibilities which are there, which challenge a myopic eye. And of course, eye trace forms an important segment of my routine cataract surgeries. It goes without saying, when I'm planning a premium IOL in a post-LASIK eye, angle alpha is absolutely mandated. I need to know whether the higher order aberrations are quite all right, which are not a very irregular cornea. But in this conundrum of things, that is one thing which I need to remember. Yes, I'm debating against Partha, but there is an altered ratio of the anterior and posterior corneal surface, because of which the ELP could get underestimated. I may get a hyperopic surprise, but I have annuals for that. Why would I look at the older formulas? I have these Barrett's formulas, and I'm sure Partha is using premium IOLs in his post-laser vision corrections, because there are hordes of them coming back to you. And when you have so many factors which are being looked into with these newer generation formulas, and why would I hesitate in not doing a premium IOL in a post-laser vision correction with the way the IOL technology and the surgical expertise where it stands? Believe me, we all know that the Barrett Universal takes into account the various principal planes and the various geometry of the lenses, and it ensures that you always look into the effective lens position change which could occur with the changes in the thickness of these lenses. Today, we have total keratometry. I would, of course, look at having my setup premium if I want to deal with these LASIK eyes. But then if I have a total keratometry and if I can use a Barrett TK, where is the question of me not getting to win the race? Believe me, Barrett True K formulas has been consistently bang on. But of course, we would ask them to have realistic expectations, but not because they are post-LASIK eye, because that's how you talk for a multifocal patient. It provides a double K solution. All we need to do is just feed in those data, go on to the myopic LASIK mode, and then do a hyperopic or a myopic LASIK values which have to be taken in. In fact, there was a study which calculated the latest formulae supports refractive surgery eyes, And it was seen that in more than 70% of the eyes, True-K was far better than the other comparable and equally withstanding formulas and doing extremely well in all these situations. Now, coming back to this patient, did a biometry and decided to use the Barrett formula, and 21.5 and 21 was what it was needed. But look what it showed. It showed that there was significant astigmatism in both her eyes. And you have to understand that we need to look at in the posterior, post-op astigmatism is an enemy of multifocal IOLs. So then what I did, looked at the cornea topography, ensured that the astigmatic magnitude was stable, the cornea was fine, it was symmetric. And of course, I would do a literature search before I come to this kind of a podium and talk. And this was a study done by Douglas Cork et al., where they said that a regular bow tie corneal astigmatism within the 3 millimeter zone, of course, you could do a premium IOL in these post-LASIK eyes. A difference in corneal astigmatism magnitude between the two IOL mask and lens star less than 0.75, go ahead. A difference in astigmatism meridians from the two biometers should be less than 15 degrees. I might look into that. I would look into the histograms of how so many eyes post-LASIK myopes and hyperopes did with the premium IOLs. And again, innumerable studies tell that with the present day multifocals, we are bang on. I would even look at the Hagesel. Why would I not look at the other comparable formulas? And they also have the centroid assay. They also look into the variable toricity ratios, ensuring that we are bang on with the ELP, and the PCA is also accounted for. The current day multifocal strengths have evolved over the time to compete with our surgical skill, compete with our knowledge. I could even do a mix and match with these eyes if such a situation demanded. I have trifocals, the fine vision, the AT-LISA, the panoptics. Look at the total energy loss is just about 14%, which is hardly much. And if you look at the defocus curve, they are bang on for distance, bang on for intermediate, and bang on for near vision. And the kind of optic zone which the present day multifocals have, you could have an angle alpha even up to 0.8 or 0.9 and still implant a multifocal IOLs in these eyes. And if you do a premium cataract surgery, which I would if I have access to, I could center these eyes on the capsular bag, which is the way to go. And then all that does, it does the fragmentation for you. It does the softening of the cataract for you. All you have to do is to just bunch up the rexus and take it off. All that you have to do is just do a gentle hydro, because pneumodissection is done, just separate the nuclear fragments. There's no phacopar which is being used. Possibly it's redundant to tell all these things. The surgery is premium and the results are premium, a plano vision for distance, intermediate, and near. So everything you choose, friends, comes from your choices, and look at your choices. What a new technology does is actually it is creating newer and newer opportunities for you to do a better job, more than what the customers want. Of course, I would explain to my patients that these implants come in certain sizes and maybe a post-op touch-up is just a part of the plan. But why would I not touch these eyes for a multifocal IOL? In fact, if you have a conceptualized approach in your mind, it opens you up to all the challenges and takes you to the right path. Why? I can't understand why today we would hesitate to stay abreast to the changing world, and why not we grasp the moment? Change is constant, and that's what Mohan Rajan also said. Friend, dear Partha, you need to have the ability to perceive logic. You need to be realistic. You need to have the foresight to win that moment. And today, you should have the acceptance of defeat, because that is the need of the hour, because you're contesting and fighting not with Chitra, but the topic of that post-LASIK eyes, that you would deny them a visual independence. I think you should just move off from this debate. Forgive yourself for not having the foresight to know what now seems so obvious in hindsight. Believe me, I always believe in being a winner and giving the best of experience to my patients. Thank you. And I truly believe that all of us would go back and place a multifocal IOL in our post-LASIK eyes. Thank you.